Hello, everyone, and welcome to this session of Inspiring Women Transforming Science, a virtual event by the Rosalind Franklin Society that highlights successes and spotlights critical change makers. I'm Uduak Thomas, Senior Editor at GEN, and it is my pleasure to be your host for this Leadership in National Initiative session. It is also my distinct honor to introduce our distinguished guest. Dr. Wanda Barfield is the Director of the Division of Reproductive Health at the U.S. Centers for Disease Control. As Director, Dr. Barfield leads efforts to provide optimal and equitable health to women, infants, and families through improved surveillance and applied public health research during the critical junctures of population health. And these are pregnancy, infancy, and adolescence. She received her medical and public health degrees from Harvard University Medical School, completed a pediatrics residency at Walter Reed Army Medical Center, and completed a neonatal perinatal medicine fellowship also at Harvard University. Now, adding to that already very impressive resume, Dr. Barfield is also a professor of pediatrics at the Uniformed Services University of Health Sciences, and she is a retired Assistant Surgeon General in the U.S. Public Health Service. She continues to provide clinical care to premature and other critically ill newborns. Dr. Barfield, it is a pleasure to have you here. Thank you so much for joining us. We're going to kick things off with a quick presentation, with a brief presentation, and then I'll come back and we'll have a conversation about leadership at national initiatives. And with that, the floor is yours.
Well, thank you so much for this opportunity to really talk with all of you as part of the Rosalind Franklin Society. It is just really wonderful to have the opportunity to think and talk about how we can transform the science as women in these fields. I want to just talk maybe a little bit about the work that I do at the Centers for Disease Control and Prevention as the director of the Division of Reproductive Health, and how my journey and my career has led to this place that I am now. It has really been an honor to be part of CDC, and it was a place where I had no idea that I would be here, but there were many influences in my career as I grew up that got me to this place. So I had some fairly humble beginnings as the child of an enlisted Navy man. My father was in submarines. He was what was called the chief of the boat, and he worked in nuclear submarines. And my mother at the time was an aspiring actress, and we moved to California so that they both could have an opportunity in that area, in those areas. And I initially wanted to be a veterinarian. I loved animals. I loved the opportunity to take care of sick animals and care for them and see them to health. And as I grew up in Southern California, I was really interested in that, and then went to college and noticed the statistical report that noted that Black babies died at a rate twice that of whites. And at that time, that statistic really shook me and made me become more interested in how I could help other vulnerable creatures, and that was caring for infants. And I decided that pretty early in college that I wanted to pursue a career in newborn medicine. Now, again, my parents had not been in college or educated through college, but I had determination, and also many people around me, women included, who were inspirations. My chemistry professor, Dr. Tagapera at UC Irvine, was an amazing inspiration in seeing what she went through in her experience growing up, from her upbringing in Romania to coming to the United States, to other mentors who were peers in my undergraduate education. But because my parents did not have a lot of resources, I had to think after college what I would do in order to afford medical school. And I was very comfortable with the military, understood that in that environment, there were opportunities in terms of a diverse staff, a diverse group of people. And I decided that I would join the US Army after being accepted to Harvard Medical School. And I was part of what was called the Health Profession Scholarship Program and had a chance to not only go to Harvard Medical School, but also to think about an education where I would not be in a lot of debt. And as many of you know, many women, particularly minority women, face a lot of potential educational debt. So after being at Harvard Medical School, I had a chance to be inspired by several other mentors who helped me to understand this question that I initially had, and that was, why were Black infants dying at a rate twice that of whites? And that was a question that still stuck in my head. And I decided as an initial thesis to look at birth outcomes of low birth weight and mortality in military and civilian populations in the state that I grew up, California, and comparing those outcomes and finding that the disparity in low birth weight was reduced. However, it was not eliminated, and neither was outcomes such as infant mortality. So that really got me thinking about what more could be done at a population level, as I also learned to care for premature and medically complex babies. And my experience in the military, again, really gave me a chance to see the diversity. I was inspired by other amazing women, my fellow residents in the field of pediatric were absolutely amazing, all in their own right. And we fostered a sense of determination. We supported each other. And during this time, there weren't as many women in training who were also parents and at that particular time. But seeing in the military where there may have been more of a fostering of family and support and extended family really was quite an inspiration for me to think about how I could serve as an Army physician and also as a neonatologist in the military. But one of the things that I think has been really important in terms of the experiences of minority women is being in an environment where there's a lot of fostered support. And again, in the Army, there was such diversity, not only in the patient population, but in those who worked in the health professions, that it was really very supportive and rich environment in which to grow. I probably would have continued in the military, although I knew that I really had a passion for helping others, and particularly those that may not have had access to healthcare, access to other supports that military families had in terms of their supports. And after finishing my work in the Army, I had an opportunity to transfer from the Army to the Public Health Service. And at that time, went into what was called the Epidemic Intelligence Service at the CDC. So I joined the CDC in 2000 and have been at CDC ever since. It's been quite a journey in the Centers for Disease Control and Prevention, and one of my experiences shortly after meeting the partner of my dreams, my husband, Joe Summers, we had a son, and shortly after, I got called to support a major catastrophe in the United States, and that was 9/11, and was deployed to New York shortly after to help with syndromic surveillance. And although I continued my work in the Division of Reproductive Health, it really started to make me think about how we better prepare pregnant women, infants, postpartum families, and young families for disasters. And that's been part of the work that we do in the Division of Reproductive Health. There are also other important areas that my experience have led to and have allowed me to be more involved in, to include pregnancy-related mortality, issues related to assisted reproductive technology. We also do work in infant health and preterm birth and prevention of the sequelae that lead to infant mortality, as well as the work that's important in the field as we understand how different states may vary in their health issues and challenges, and how we would build capacity to support state health departments. Also, in terms of thinking about the journey, I've also been thinking a lot about how do we better support minority women, working with historically Black colleges and universities, thinking about the work of Hispanic serving institutions. How do we create a diverse workforce? Because there really is an opportunity to learn from everyone as we improve the health of our populations. It's also important to think about balance. That's an area that sometimes is really challenging as a woman wearing many different hats. And I think in my mind, we can't always do everything, but we do have an opportunity to think about, one, how we prioritize, what things are priorities at different seasons of our lives, and how we can still think about the long term and how we can actually balance work and life, but thinking about the priorities in those different stages.
Thank you so much, Dr. Barfield. That was amazing. I always love hearing the stories of people's stories of how they started and got to where they are now, and seeing all the accomplishments that you have. It's really impressive. And there was a lot in your story that I really resonated with and that I enjoyed hearing about. So at the CDC, obviously, we've come a long way, and you are a woman in leadership. Obviously, we've come a long way. There's a lot more women, and particularly minority women, in leadership positions, specifically in the STEM fields. We do see more of that, but there's still a long way to go. And we know that women are going, more and more women, more and more minority women and other minorities are going to college now than ever. But there's still that gap that's happening. So I was wondering if you could share a little bit about the ways your division at the CDC, or even at the CDC as a whole, are working to expand opportunities and create that supportive environment that really nurtures participation from women and other minorities.
Yes, so I think that it's important to just remember that this is really a team effort. At the time that I trained in undergraduate as well as medical school and residency and in the Army, it was a really male-dominated workforce. My medical school class was majority male and majority white. And things are changing now as we see residencies, particularly in the fields of, pediatrics, change. But it is still important to note that many of those mentors were majority mentors. And so that there is the opportunity for everyone to foster an environment of diversity, no matter where you're coming from. And I think that's really important to note, because some of my strongest mentors didn't look like me, but they saw the potential, they saw the opportunity, and now I have an opportunity to inspire others. And I think in thinking, no matter what area that you're focused on, one, having that intentionality of trying to identify a diverse workforce is really important. And it's not just the diversity of sort of race, it's the diversity of abilities, it's the diversity of thinking, it's the diversity of upbringing and background. It enriches all of the work that you're doing. Getting multiple perspectives is really important. But we do know that for minority people and women, that there are additional challenges, and we do need to think about ways that we can increase the diversity of the workforce by, one, reaching out maybe in areas that aren't so obvious. I mean, even for folks at CDC, we understood that we have a rich array of universities, not only throughout the state, but throughout the country. So how can we connect with the variety and the rich variety of student body and student populations? But also there are communities here in Atlanta where we can model to young people. I mean, for example, as a Commissioned Corps officer, you know, we would go to local high schools and just go in our different uniforms. The U.S. Public Health Service has a variety of roles, whether you're a nurse or a doctor or a dentist or a scientist or a veterinarian, and just all coming together to go to a local high school and say, hey, this is what we do in the public health service. This is our journey. We just want to share with you that it is possible. That those are really important things, to be seen, to have that conversation, particularly with young people, to encourage them, and to just continue to support them throughout their journey. So that's something that I really enjoy. I really enjoy engaging with people in their journey in science. And again, it doesn't have to be a traditional path. Certainly mine was not. There may be people who have had a career or who have been doing something different or participating in raising their family and then deciding that they would like to do something additionally. And I can tell you from personal experience, it's something that, I mean, we do within our own division.
Absolutely. I love what you said about this being a team effort and that there's a lot that multiple people can contribute. And that certainly was true, I think, in your life. I mean, was your obvious determination and grit to get to where you did. But you also talked a lot about mentors, your chemistry professor, and then your undergraduate mentors as well, who were very instrumental in helping you. And I was wondering if you could talk a little bit about how you went about building those relationships, and if you have any tips for how women and other minorities can do the same for themselves.
Yes. So, you know, my first most important mentors were my parents. I mean, they didn't have the formal education, but for example, my father was always encouraging, you know, you can do it. You put your mind to it. He used to have sort of like a visualization board on our refrigerator. And I started to do that for myself as a habit in college. You know, when I applied to medical school, I wrote all the top medical schools on the refrigerator and, you know, sort of visualized where I would go. And those are the kinds of things that you can get from people who aren't necessarily in that traditional position. You know, my mother, you know, a very faithful woman, was always supportive, very positive, always encouraging. Making sure that you're surrounding yourself with your supports, with your cheer people is really important. But also thinking about mentors that aren't just traditional in maybe the scientific journey. Certainly, I've had scientific mentors who have been wonderful in the Army, as well as in my residency and at CDC. But thinking also about mentors that are less than typical. Who is your peer mentor? Who can help you, for example, as maybe you're thinking about your family, you know, raising children, balancing your work and life? Who are the examples that might share that kind of mentorship that's important? you want to think about people who have your best interest in mind and are looking to help you be successful in whatever it is that you do. And people who will also be honest with you as you're sharing ideas and direction, but they also need to have a good understanding of where you want to go. And so that's why it's important in terms of thinking about a mentor, because a mentor isn't a supervisor. A mentor is someone, again, who has your best interest in mind and is trying to help you in your journey to get to your destination.
Absolutely. Absolutely. Thank you. You have a lot of responsibility. You're very busy, but it's a new year. We're at the start of 2024. I guess, what's the top of your to-do list for this year? What do you hope you'll be able to implement by the end of the year?
So there's a lot of things that are very exciting about the work that we're doing, particularly in the Division of Reproductive Health. But I think, honestly, we're also thinking about how we can also, and I personally, how I can say no to some things. Because, I think, fortunately or unfortunately, myself, I think I tend to want to try to help as much as possible. But sometimes, again, in balancing your life, there are going to be important no's to say. And often what I say to people who are thinking about their careers and decisions and opportunities is, if you say yes to something, what do you need to set aside so that you will have time for that? And so that either means, saying no to something else or pivoting away from something else so that you can say yes, or maybe saying no to that opportunity, or maybe not at this time, or how can I do this in a different way, or who else might be able to do it. And granted, depending on your level, there's some times when you can't say no to certain things, but I think it's important, particularly as you're thinking about, opportunities, really thinking clearly about what might need to be moved to the side so that you can fully pursue a new opportunity.
Yeah, absolutely. Absolutely. I love that. And if I could ask one more question. I mean, we talked about what you've accomplished. If you could go back in time and give your younger self a piece of advice, and I mean, this could be anything at all in terms of, if you now looking back on your career and all you've accomplished, what would you say to your younger self to get you to keep going?
Oh, wow. Well, one thing that I would say to my younger self would probably be to stick with learning a second language. I did start to learn some Spanish, but if I could say to my younger self, really focus on that, because I do think that, having a second language is really an important thing. I think it's also an important thing for, young people, as this world, again, as we change and we learn opportunities to really communicate in different languages. That's one of the things that I would say to my younger self. The other thing I would probably say to my younger self is, it's okay to not always get it correctly, and to not necessarily be critical of errors. I think you learn from your errors, you learn from your mistakes.
Yeah, absolutely. Absolutely. I think that is wonderful advice. And I think definitely something a lot of particularly women can relate to as well, because there is that tendency definitely to be very critical at times, and maybe feel that if I don't get it right the first time, then it's not worth it or something. So I definitely think that resonates, or will resonate with a lot of people. Dr. Barfield, I'm so grateful to you. Thank you for being here today, and thank you for your presentation and for taking time to answer some questions.
Oh, thank you so much. This has been really wonderful, and it's really an honor to speak on behalf of the Rosalind Franklin Society's virtual event.
Absolutely. Thank you. And that brings us to the end of our discussion and concludes this particular session. To our audience, please stay tuned for the next session in our program. Thank you.